first thing you should take away is sugars. Cancer needs three things. It needs an acidic environment, meaning not alkaline, but acidic. It needs a hypoxic environment, an area of the body that's deprived of oxygen. In the mortality space, we used to say that the presence of oxygen is the absence of disease.
What does that mean exactly?
That means that we did not find a single disease etiological pathway, meaning source of disease or something that made disease worse, that did not have its roots in a lack of oxygen.
How do you get oxygen to your blood?
So let's talk about, like, for example, the largest reason that somebody would walk into one of our clinics, my clinics, which are called 10X Health, is, younger age, middle age, older, as they walk in, they're like, I just don't have the same energy level I used to have. I'm tired all the time. So when you tell me you don't have the same energy level, I just convert energy into physiology.
A second patient crossed my path. A guy in his 70s who had been losing weight for a year and a half, 40 pounds, not vaccinated, 40-pound weight loss, smoker, drinker, all he does is fish. And he could no longer swallow, and he could hardly talk. And so I got on the phone with him, and I said, Eddie, tell me a little bit about your history and so forth. He knew someone with prostate cancer who had taken ivermectin, had cured himself from prostate cancer with that. So Eddie began taking ivermectin. I have no idea what the dosing was. He was just taking it. And I gave him some advice about diet and, try and get the weight back on and so on and so forth. Within a couple of weeks, he sounded stronger. Sounded stronger. He could swallow. He had gained 6 pounds. His voice was better. Followed him for the next couple of weeks, maybe another month or so, and I said, Eddie, we need to get a scan. He doesn't have insurance, he doesn't like doctors, whatever. He had been diagnosed in that interval with 2 esophageal tumors, unresectable. Surgeons wouldn't go near it. The doctor said, well, we'll give you chemo and radiation, and Eddie said, no, you're not. So he takes his ivermectin, and maybe about 6 weeks later, I said, Eddie, you need to get a scan. I had to argue with Eddie to get a scan. We got the scan. No tumors, gone.